Yes, ma'am.
Good evening, everyone. Myself, Dr. Aanchal, and now we are having the series of 45 days to MBBS final intensive revision series. So in this series, we do rapid revision of all the important topics, volatile facts through quick revision. We discuss here high topics we cover of all the subjects, and also we discuss most expected topics which are important for all the university exams. Right. So in today's class, we're going to discuss about the immunity, hemostasis, and platelets. In immunity, we're going to learn about the classification. We're going to know about the role of B and T lymphocytes. Then we're going to classify the T lymphocytes, and also we're going to know about the mechanism of cellular immunity. Then we're going to know about macrophage system, T lymphocyte function, and temporary hemostasis. And in short answers, we're going to discuss about the purpura, functions of platelets, autoimmune phenomena, and acquired immunity. So the question is why to choose Auricle? So the Auricle is very important because recorded classes we provide here, live sessions are there, practical sessions are there, exam module is there, and also we provide hard book sets. So recorded classes are there for the elevated learning of the student so that the student can have the access of all the subjects, access of all the classes through this platform. Then live classes are there. Live classes are there because we are having educator who are more experienced, and live classes are there so that the student will have a interactive learning with the educators. Then exam module is there. Exam module is designed in such a way so that the student will be able to improve answer skills, and also with those exam module the student will be able to answer properly, and surely he or she will able to complete the entire syllabus. Then we provide one-to-one doubt clearing session. Doubt clearing sessions are there. Doubt clearing sessions are there so that the student will have the interaction with the student, and if any kind of doubt is there, then student will able to clear that doubt easily. Then practical sessions we provide. In practical sessions, sessions are there so that the student can improve their viva voice, improve their skills, and whatever the topic, whatever the thing they want to learn, they can learn it through the practical sessions. Then question bank is there. Question bank is there, of course, to improve the exam writing skills, and also we provide the questions in the exam skills from beginner level to expert level. Then hard copy sets are provided. Hard copy sets are very important because in hard copy sets, you will find all the past 10-year, previous year question answers. And also you will find the very important topic that are very, very important for the all the university exams. Then in Auricle, we provide subscription plans starting from basic to premium. In basic plan, we have the services like pre-recorded classes, live class, and quick revision examination module that cost around 19,999. In standard plan, the services are pre-recorded class, live class, quick revision examination module. The cost around 34,999, and premium plan in which services included like pre-recorded classes, live class, live doubt clarification, one-to-one personalized guided notes, quick revision examination module. And this premium plan cost around 59,999. So I would suggest all the students to subscribe to Auricle as soon as possible. So let's start with today's class. So in today's class, the first topic we have is acquired immunity. So before knowing about immunity, about acquired immunity, we should first know that what is immunity. So we know that immunity is defined as the capacity of the body to resist pathogenic agents, right? So immunity is the ability or capacity of body to resist pathogenic agents. So basically, the immunity is the ability of the body to resist the entry of different types of foreign bodies like bacteria, viruses, toxics, and other substances which are harmful for our body. Okay, so we know that the immunity is classified as innate and acquired immunity. So in this question, we're going to learn about acquired immunity, and as we can see, this question is very important because it has previously asked in Rajasthan state question in state exam, Delhi state exam. So it is very important. So acquired immunity means adapted immunity. The person who has already adapted at that. Okay. So acquired immunity is the resistance developed in the body against any specific foreign body like bacteria, like virus, like toxin, like vaccines or transplanted tissue. Okay. So we can call that this type of immunity means acquired immunity is also known as specific immunity because it is developed for very specific type of thing. Okay. So the acquired immunity is also known as adaptive immunity. It is a type of immunity that the individual developed during their own lifespan. Okay. And also this type of immunity has memory cells. Whereas the other immunity like innate immunity, that is not specific to a particular thing because it is present since birth. But the acquired immunity is the immunity that is acquired by the individual in their own lifespan. Okay. Then the acquired immunity is classified as active and passive. Okay. So active means the immunity that the individual developed after being exposed to an infection or from getting a vaccine. Means this type of immunity will have the memory cells, right? Whereas the passive immunity like the individual will acquire from someone or something else. Okay. Just for example, if I say like in natural, the antibody is transmitted from blood from mother to baby, like mother's milk. Then in artificial, like antibody is acquired from an immune serum medicine, like in case of snake bite, if the snake has bitten someone, so we obviously give the anti serum. Okay. So the passive immunity will never have memory cells, but the active immunity will always have memory cells because the active immunity is the immunity which is developed by the production of antibodies, whereas in passive immunity there is no production of antibodies at all, right? So this is the main difference between the active and the passive immunity. Okay. Then another thing about acquired immunity, that acquired immunity is also classified as cellular and humoral immunity. Okay. So about cellular and humoral immunity, we're going to learn in further slides. So next question we have, classify immunity. Explain the role of B and T lymphocytes in immunity. Okay, so as we can see, immunity is classified as adaptive immunity and innate immunity. Then in adaptive immunity, we have natural and artificial. And in natural, we have active passive. And in artificial also, we have active immunity and passive immunity. Okay, so this is how we classify the active, the immunity. Okay, adaptive immunity and innate immunity. Okay, now next question we have that we're going to discuss about the role of B lymphocytes and T lymphocytes, which is our important thing. So if we talk about T lymphocytes, so T lymphocytes are those cells which enter from thymus, from circulation, and are processed into T lymphocytes. Okay, so basically they get originated in bone marrow, they get matured in thymus, and from circulation they are processed as T lymphocytes. Okay. Now, the processing occurs during mostly during the period just before birth and few months after the birth. Okay. So that is the processing period. Okay. So the thymus secrete a hormone. Thymus secretes a hormone that is known as thymosin. And this thymosin is very, very important for providing immunity to the body. Okay, as this accelerates and the accelerates the proliferation and activation of lymphocytes inside the thymus. Okay, and also this is responsible for increasing the activity of lymphocytes in lymphoid tissue. Okay, so this is the main thing about T lymphocytes. Another thing, the T lymphocytes are responsible for the development of cell-mediated immunity and there will be activation of helper T cells and they will lead to activation of cytotoxic, which is also a type of T cell. And finally, they will lead to destruction of invading organism by direct attack. Okay, so this is the main criteria and main things about T lymphocytes. Okay, now also we're going to know about the main function and the classification of T lymphocytes that we'll learn in the further slides. Now coming to B lymphocytes. So B lymphocytes was first discovered in the Persa of Fabricius and has named as B lymphocytes is basically a lymphoid organ situated near the cloaca of a bird. Okay. So if we talk about the B lymphocytes, so after processing the B lymphocytes are transferred into two types of cells. The first we have plasma cells and second we have memory cells. Okay, now this B lymphocytes also, as a result of development of humoral immunity. So basically B lymphocytes are responsible for the development of humoral immunity. So as there will be development of humoral immunity, they will lead to activation of B cells and there will be formation of plasma cell and plasma cells will lead to production of antibodies. And as there will be production of antibodies, so it will lead to destruction of invading organism by antibodies. Fine. Okay, so another thing we have another question we have classified the T lymphocytes and explain the mechanism of cellular immunity. Okay, so cellular immunity is also known as cell-mediated immunity, and about that we're going to talk about. Okay, so first we're going to know about the classification of T lymphocytes. Okay, so T lymphocytes are classified as helper T cells, then cytotoxic cells, then suppressor T cell, and the last, the memory T cells. Okay, so T lymphocytes are, again, I'm repeating, the classified as helper T cells, cytotoxic T cells, suppressor T cell, and memory T cells. So these helper T cells, or they are also known as induced T cells or Th cells which help other T lymphocytes in immune system response. Okay, and these helper T cells are also known as CD4 T cells because of the presence of CD4 receptors, protein molecule on their surface. Okay, so another we have cytotoxic cells. So our cytotoxic cells are also known as killer T cell, right? And they are also known as CD4 T cells because of the presence of CD4 receptors on their surface. And another two we have suppressor T cells and memory T cells. Okay, so the suppressor T cells are responsible for providing the suppressive activities, whereas the memory T cells are responsible for the production of antibodies. Then another thing we have, explain the mechanism of cellular immunity. So whenever we talk about cellular immunity, means cell mediated. Okay. So cell mediated immunity is defined as the immunity developed by cell mediated response. Okay. So this is developed by cell mediated response. Okay. And the another name of this type of immunity is T cell immunity. Now, this type of immunity involves in several types of cells such as T lymphocytes, macrophages, natural killer cells. Okay, so that's why it is named as cellular immunity. Okay, but this immunity does not involve production of any antibodies. Okay, so this does not involve production of antibodies. And basically the cellular immunity is the major is known for providing the major defense mechanism against any pathogen like viruses, bacteria. Okay, so this is responsible for the defense mechanism inside the body, and this is also responsible for the delayed allergic reaction and for the rejection of transplanted tissues. Okay. Now, this cell-mediated immunity is offered by T lymphocytes and it starts developing when T cells comes in contact with the antigen. Okay. So, what happened? Usually, the invading microbial or non-microbial organism carry the antigenic material, and these antigenic material are released from invading organism, and that is presented to the helper T cells by the antigen presenting cells. Okay. If we talk about antigen presenting cells, what are antigen presenting cells? Those antigen presenting cells are the special types of cells in the body which induce the release of antigenic material from the invading microorganism which has entered inside the body illegally. Okay, and later present these material to the helper T cells. Okay, so that the helper T cells can perform its own mechanism. Right? Fine. So next we have the macrophage system. Okay. So we know what are macrophages. Macrophages are the large pathocytic cells which digest the invading organism to release the antigen. Okay. So what are macrophage? Macrophage are large phagocytic cells which digest the invading microorganism, means they perform the function of phagocytosis. Okay, so invading organism to produce the antigen. Okay, and the macrophages are present along with the lymphocytes in almost all the lymphoid tissue. Okay, so the process of phagocytosis, which is basically an act to defend the host against infection and any kind of injury, is done by this macrophage system. Okay. Now, if we look at the morphology of the macrophage, so the morphologically, the macrophage appear like a irregular nuclear content. It has granule to linear chromatin. It also have cytoplasmic granules and cytoplasmic vacuoles, right? So basically, these microphages are not found in essentially all the tissues, but where they patrol for potential pathogen by amoeboid movement. Okay, so they take various form with various names throughout the body, like Kupffer cells, alveolar macrophages, microglia, and others. But all are part of the mononuclear phagocyte system. Okay, so the macrophage system is a very important system which is responsible for providing the defense mechanism, or which is responsible for acting as a process of phagocytosis, so that this system can easily eliminate all the foreign antigen, all the bacteria, pathogens which has illegally entered inside our body. Okay, now next we have the function of T lymphocyte. Okay. So already we have discussed about the T lymphocytes. Already we have seen the different types of T lymphocytes. Now, if we talk about the major function of T lymphocytes, so T lymphocytes, एक मिनट बंद कर दो. So T lymphocytes are basically the cells which are responsible for providing the defense mechanism. Okay. So the T cells are key fighters in what's known as your in the adapted immune system. Okay. So these are the fighter cells which are responsible for providing the defense mechanism inside the body. Okay. And each T cells is unique in that it is designed to fight only one type of pathogen. Okay. So each T cell is defined to fight against specific type of intruder. Another thing, that T cells copies itself and make more T cells to defeat the pathogen. Okay, so T cells copies itself and make more and more copies to fight against pathogen, right? Another thing about T cells, that the T cells are also known as the antigen presenting cells, which is responsible for invading the location of the pathogen. Okay, so these are the main functions of T lymphocytes. Then next we have the very important mechanism that is known as temporary hemostasis. Okay, so we're going to learn about the temporary hemostasis. So what is hemostasis? Basically, the hemostasis is the process, or it is defined as the physiological arrest of bleeding. Okay, so whenever we talk about the temporary hemostasis, means it means the formation of temporary plug. Okay, so the temporary hemostasis basically occurs in 3 stages. First, we have vasoconstriction. Second, we have platelet plug formation. And third, we have finally coagulation of blood. So one by one, we're going to know and we're going to understand about each and every step. Fine. So vasoconstriction means whenever there is injury occurs. So they will lead to the blood vessel constrict immediately, and it will lead to decrease the loss of blood from the damaged portion. Okay. Suppose we have the blood vessel and injury. The blood vessel has broken from this side. So the vasoconstriction is the process by which the vessel will get constricted so that the release of blood can be minimized. Okay. So this is the most important significance of the vasoconstriction. Then next we have platelet plug. Okay. So basically formation of platelet plug will occurs by the process of adherence and aggregation of platelets. Okay. So platelets adherence to collagen of ruptured blood vessels secretes a very important substance, that is ADP, means adenosine diphosphate. Okay. So ADP is an important substance. Then second is thromboxane, A2. Both are very, very important substances. Okay. So these two substances attract more and more platelets and activate them. As the more and more platelets get activated, so they get aggregated to a particular site and it will lead to formation of temporary plug. Okay. And afterwards, this temporary plug is converted into the permanent plug by the process of coagulation. Okay. So finally, the coagulation is there. So coagulation of blood, basically, in this process, the fibrinogen is converted into fibrin, and fibrin thread get attached to the loose platelet plug, which is formed by the platelet, as we can see here, right? So fibrinogen is converted into fibrin, and the fibrin thread get attached to the platelet plug, and finally, this will block the ruptured part of blood vessel and prevent further loss completely. Okay, so these are the 3 steps, and these 3 steps again we're going to discuss with the help of flowchart. Okay. So if the question over the hemostasis, because it is an important question, because it has repeated several times in many university exam, and also you can expect this question in your exam also, because this is the most favorite question of all the external examiner. So if you draw the flow chart in that question, so obviously you will be able to score very higher marks. Okay. So the temporary hemostatic plug, basically the first step will be whenever there is injury to blood vessel. So it will lead to damage of endothelium, and endothelium will damage. So it will be exposure of collagen. So first, what will happen? It will lead to adherence of platelet to collagen. Platelets which are already present in the circulation. Then adherence will lead to activation of other platelets. And whenever there is activation of other platelets, so 3 steps will occur one by one. So first, it will lead to secretion of serotonin, and serotonin will cause vasoconstriction. So this is stage 1, okay, or step 1 you can say. Then second thing, as vasoconstriction will be done, then activation of platelets will lead to secretion of very 2 important substances. The first is ADP and the second is thromboxane A2, right? So with the help of secretion of ADP and thromboxane A2, there will be more and more aggregation of platelet. As more and more aggregation of platelets will occur, so it will lead to formation of temporary hemostatic plug. So platelet plug formation will occur. Okay. So this is the stage 2. Okay, where temporary hemostatic plug has formed. Okay, but this temporary hemostatic plug need to get converted into permanent one. So this will lead to formation of prothrombin activator, and finally the blood clotting process get completed. Okay, So this is all about the temporary hemostatic plug. Okay, and also this is the very important question. So you can expect this question in your university exams definitely. Okay, another thing we have the purpura. So purpura is basically a clinical condition. Okay, so purpura, as you can see in the picture also, this is how the purpura look. Okay, so this is a disorder, and this is characterized by prolonged bleeding time. Okay, so because of this disorder, the bleeding time get very longer. Okay, so what is the characteristic feature of this clinical condition? So the characteristic feature is look like this, means there will be spontaneous bleeding under the skin from ruptured capillaries. Okay, so it causes small teeny hemorrhagic spots like this, as we can see. So because of this condition, it will lead to small hemorrhagic spots. Okay, and this type of spots can occur in many areas of the body, and because of presence of these spots, that's why this disease is known as purpura, because purpura means the purpuric spots, means purple colored patch like appearance that occurs inside the skin or beneath the skin, you can say. Okay, that's why this condition is known as purpura. Okay, so now we're going to discuss about the types and causes of purpura. So purpura is classified into 3 types depending upon the causes. Like first we have thrombocytopenic purpura. Another we have idiopathic thrombocytopenic purpura. And third we have thrombasthenic purpura. Okay, so one by one, we're going to know about the various types. So first we have thrombocytopenia. So thrombocytopenia is basically a condition in which there is decreased level of thrombocytes, means platelets. Okay, so thrombocytopenia is occurs due to deficiency of platelets, means the thrombocytes. Okay, so in bone marrow disease, the platelet production is affected, leading to decrease or reduction in the number of platelets. Right. Another thing we have idiopathic cytopenia, means basically purpura due to some unknown causes it occurs, and this is known as idiopathic purpura because it occurs due to some unknown, means the cause is not yet known. Okay, and it is believed that in this type of disease the platelet count decreases due to development of antibodies against platelet. Okay, and which can be occurs due to blood transfusion also. Right. Then last we have thrombasthenic purpura. So basically in this condition, it occurs due to structural or any kind of presence of functional abnormality inside the platelets. Okay. And in this case, the platelet count will remain normal, but it is characterized by normal clotting time, normal or prolonged time, but defected clot retraction. Okay. So there will be defected clot retraction because of that thrombasthenic purpura can be occurred. Okay. So this is all about purpura. Next we have the function of platelets. Okay. So the first function of platelets is obviously very importantly the homeostasis. Already about that we have discussed. Right. So homeostasis is the platelet plug formation, means temporary platelet plug formation. Okay. Another thing in that already we have discussed 3 steps were there: adhesion, activation, and aggregation. Okay. Now we're going to know about the various functions that is also performed by platelet. Okay. So another function will be, so first we have discussed hemostasis. Then another we'll have is role in blood clotting also. So platelet are responsible for the formation of intrinsic prothrombin activator. So that is responsible for the onset of blood clotting. Then another will be role in clot attraction. So already we know what is clot attraction. Clot attraction means after the formation of plug, there will be 40% reduction in the size. Okay. So in the blood clot, the blood cells induces platelets and that are entrapped in the fibrin threads. Cytoplasm of platelets contain the protein that are known as contractile protein like actin, myosin, thrombastin, and they are responsible for the clot attraction. Okay. Then another we have the role in defense mechanism. So platelet also responsible for providing defense mechanism by the property of agglutination. Platelet encircle the foreign particle and destroy them. Then role in repair of ruptured blood vessel. Okay, so platelet drive growth factor that formed in cytoplasm of platelets is responsible for the repair of the endothelium and other structures of the ruptured blood vessel. Then last we have autoimmune phenomena. Okay, so autoimmune phenomena already we know. Basically, autoimmunity is a thing that present inside the body. It is basically the ability of the body to distinguish between its own or unknown thing, right? To distinguish between self and non-self. Okay, so autoimmune response in solid is like the thing that this is the thing that is present inside body, means body self and non-self cells. Okay, then another thing that if the body cells are uh, start attacking to its own cell, so it will create the other types of disease like autoimmune diseases there. Okay, so we know that immune system normally works to defend the body and eliminate infection caused by bacteria, by viruses and other invading microbes, and don't react with self antigen. But if a person's immune system mistakenly attacks self and targeting the cells, tissues and organ of our own body, so it results in autoimmunity that may manifest as autoimmune disease. Okay, so there are many, more than 80 different kind of disease are there that is caused by autoimmunity. Okay, so basically the autoimmunity is, you can say, the failure of immune tolerance. Okay, so the cause of the autoimmune disease is exactly known, and some autoimmune disease already maybe you are familiar with. So basically these are the genes that people inherit contribute to their susceptibility for developing an autoimmune disease. Okay. Okay, so basically you can say that autoimmunity is due to failure of immune system. And in this, the body will start targeting its own cells, its own tissue mistakenly. Okay, so fine. This is all about the today's class. I guess we have covered all the important topics. So we have covered immunity, T lymphocytes, macrophage system, T lymphocytes function, temporary hemostasis, purpura, platelet function, autoimmune phenomena, and acquired immunity. So I hope you find this class more helpful. So thank you so much for watching my class.